Growing up in a family of 10 with my sister Ann, it was chaos at all times. So we grew up in a house, a summer home in Pass Christian, Mississippi.
Loved to fish.
Loved to fish.
To fish.
Loved to hunt. Did all the outdoor stuff. And it was just so much fun. The day I received the diagnosis, I had no symptoms, no problems whatsoever. I felt fine. My primary care physician insisted on having a CAT scan of my chest every year because I smoked. When I went to see Dr. Pettiford, he confirmed what my primary care physician had suspected, was that it was cancer and that it was growing. Many thoughts went through my head, one of which was, okay, this is scary. This is not quite what I expected. What is the surgery going to be? What is the recovery time going to be? There were a lot of thoughts running through my head. But because I had had the CAT scans, we found it early enough to deal with it in a manner that was not life-threatening or life-altering. That's the key.
I found out that Sally had cancer and had the surgery. Worried me a little bit, but I had quit smoking 30 years ago, so I really didn't feel like I needed to be proactive. And then our brother Stephen also had the same thing, and that's when I said, you know what? Why not? Let me call my primary care physician and just see what he says. He recommended I get the CAT scan, and sure enough, same thing. Same exact cancer, same exact surgery was recommended.
Both patients had a type of lung cancer called adenocarcinoma, which is actually a very common form of lung cancer. But I think the case is unique given the fact that out of a family of 10 people, 30% rate when you think that 3 siblings all were diagnosed with lung cancer.
The great thing about Ann is that she was healthy, she had quit smoking, and she's a huge advocate for screening and early detection. And so with her family history and her smoking history, she decided that she needed a lung cancer screen. And lo and behold, it was positive for something highly suspicious for lung cancer.
So Dr. Gunn came in and she was, I've got this program, you're gonna get a biopsy, you're gonna get a surgery if you need it, all under the same anesthesia. It's new technology. And are you up for that? And I was like, I mean, I'm overwhelmed, but yeah, if I don't have to wait 2 weeks knowing that I need the surgery, I'm for that.
After extensive tests, and we all agreed as a thoracic oncology team that she was a great candidate for this single anesthesia event, I went in, did a diagnostic procedure called a robotic bronchoscopy with navigation, and get the biopsies. Our pathologist, who are also part of our team, came in, told us it was cancer, and then the thoracic surgery team, led by Dr. Pettiford, came in and really removed her cancer.
It was very comforting to me to see Gunn and Pettiford working together so well and letting us know exactly what was going to happen. For me, having the biopsy and the surgery under one anesthesia was a relief to me. I didn't have to wait 2 weeks. I didn't have to wait a month for the surgery. If it was cancerous, Pettiford was going to step in right then and do the surgery.
They did the surgery, which was done with robotics, so there's no big incision. I was home the next day. I was making turkey gumbo. 3 days later, I was back to normal, 90% normal, 3 days after the surgery.
I no longer worry about, do I have cancer? Every 6 months, I'm gonna go get a CAT scan and see Dr. Pettiford again. And I'm grateful that there are people smarter than me that have figured out how to make cancer not so scary. Also, how to diagnose it at an early stage so that it's not that life-altering diagnosis anymore.
Both patients had their cancers caught at an early stage, and hence they are doing pretty well. There's no evidence of recurrent disease.
The Ochsner experience is an interesting one because they have such a huge network of doctors, specialists particularly, who are tops in their field. They have so many people that they can call on, and they don't hesitate to call on the best. My takeaway from all of this is get checked out.